Nanofluids for cancer treatment. Magnetic hyperthermia is another treatment that could be used in conjunction with chemotherapy and radiotherapy to optimize the efficiency of combination treatment. Current treatments involve injecting nanofluids directly into the tumor because iron is toxic to the body. However, this doesn't target all affected areas and tumors regrow. Hyperthermia is a treatment used to treat cancer, and it involves heating the tumor to high temperatures to kill the cells. Iron oxide nanoparticles achieve highly efficient carcinogenic cell destruction through magnetic hypothermia treatments. By combining a high saturation magnetization with a properly functionalized surface, magnetic nanoparticles are provided with an enhanced functionality to allow them to attach to target cells or tissues and play their therapeutic role in them.
If you put iron particles in an alternating magnetic field, they flip back and forth and create a lot of heat. If they were inside a tumor, you would cook the cancer. Here at Nanoprobes, we engineered a nanoparticle with an iron core and wrapped it in a biocompatible shell. The iron core will still react to a magnetic field, but it's kept safely out of direct contact with the body.
A challenge of engineering nanoparticles is that the particles have to leave the bloodstream and specifically target the tumor. Cancer has the natural property, EPR, enhanced permeability and retention. The properties of the blood vessels in the tumors can be utilized to kill the tissue.
Since tumors are growing, they call on the body to create lots of new blood vessels in and around them.
New blood vessels are leaky, so anything of a particular size in the bloodstream will pass through and accumulate in the tumor, but stay out of healthy areas.
Huang and Hainfield found that after intravenous injection, the tumors became highly loaded with 16 times more nanofluid in the tumor than in the adjacent healthy tissues. Tumors liquefy when heated to a lethal temperature while surrounding healthy tissues stayed cool and unharmed. Huang and Hainfield found that a 3-minute treatment eradicated all existing signs of a tumor. They achieved a 78 to 90% cure rate of cancer in mice. Particle surface modification is an important parameter that should be taken carefully into account when researching the heating properties of magnetic nanoparticles for biomedical applications. The success of the treatment depends on IV delivery that adequately loads carcinomas, low systematic toxicity that enables sufficient high tumor loading for efficient heating, good tumor to non-tumor ratio, magnetic nanoparticles that heat efficiently, use of a high magnetic field, and use of high frequency. Better heating can be achieved with increased concentration, field strength, and frequency, but each parameter must be optimized so no harm is done to adjacent healthy cells. Since an adequate nanoparticle surface modification improves their specificity, the higher the targeting specificity, the more selective killing of target cancer cells will be achieved. Once nanoparticles are engineered to be the optimal size to permeate through the blood vessels, more comprehensive treatment can be conducted. Characterization of these multifunctional nanoparticles involves the use of highly advanced electron microscopy techniques, such as high-resolution transmission electron microscopy, scanning electron microscopy, and atomic force microscopy. The surface temperature of the tumor and surrounding skin will be monitored using a thermal camera. Internal tumor temperatures are monitored with fiber optic thermocouples. Research will be conducted under Dr. Ya Wang at Stony Brook University in conjunction with the Nanoprobes Lab and the National Institutes of Health.